Good afternoon, attendees of this colloquium. I am Abigail Payne, the Ronald Henderson Professor and Director of the Melbourne Institute, Applied Economic and Social Research in the Faculty of Business and Economics. Let me extend a warm welcome to each and every one of you. Let me also acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. I pay my respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Welcome to what I would like to refer to our second tranche of colloquia. A few months back, we initiated the colloquia as a way to reach out to you as we work through the lockdowns, social distancing, and working from home we are all experiencing. We initiated these events as a way for us to provide insights through the lens of Melbourne Institute researchers and to engage with you so we can better understand Australian economic and social policy. Another activity on which we embarked as we transitioned into a COVID-19 environment was the initiation of a short survey to capture the behaviour and attitudes of Australians as we experience and work through the effects of the current pandemic and now recession. We started collecting data on April 3rd, and for the first few months ran the survey on a weekly basis. Now the survey is run once a fortnight. We have a team of researchers that meets each week to decide on the questions and to truly tackle the potential concerns and issues that we think reflects the pulse of the nation. Our Taking the Pulse of the Nation involves many activities: running a survey, providing a report on the key findings, creating deeper thought pieces we call research insights, and providing you with access to key information from the survey through our interactive COVID-19 tracker that is on our website. For today's colloquium, we are deviating slightly from our standard format. We have asked 3 of the researchers who have been working on the Taking of the Pulse of the Nation to provide their insights on what we are learning through this simple but effective survey. I will keep my introductions of our speakers brief. First, we will hear from Professor Gui Lim, a macroeconomist with a long-standing history of macroeconomic forecasting and policy modeling. Next, we will hear from Professor Yuting Zhang, who is a health economist that is concerned about healthcare design, the insurance market, pharmaceuticals, and overall the effects of health system reforms. Finally, we will hear from Professor Reagan Petrie, whose interests are tied to running field and lab experiments to understand the behavioral and expectations components of a range of microeconomic issues. We have asked each researcher to speak for approximately 7 minutes. This will be followed by a few questions, and then Mr. Marcus Walsh, the head of the Victorian Department's Critical Information Unit and Chief Economist, will speak briefly to provide his insights and reactions to the presentations. Marcus is in the thick of the issues Victoria is facing with respect to the pandemic, but also plays a critical role in shaping and affecting economic policy and reform for the state. Let me remind you of a few housekeeping matters for this colloquium. This is being recorded. To handle questions and comments, we are relying on the Q&A function found at the bottom of your screen for those of you using Zoom. For those of you using Slido, you can submit questions in the box on the right-hand side of your screen. You can submit questions at any time through these functions. Now, let me turn it over to the speakers. Please join me in welcoming our speakers. Over to you, Gui.
All right, so I think I'm okay. Well, good morning, everybody. So as Abigail has said in her introductory remarks, Taking the Pulse of the Nation survey is a survey for all Australians. It's a survey of 1,200 adults aged 18 and above, stratified by gender, age, and location, so it's representative of Australia. The survey is designed to cover 3 topics, so I'll be talking about the first one, and then Yuting will pick up on health and Reagan on social well-being. So let me get straight into it. All right. One of the questions that we were interested in asking Australians was whether they were satisfied with federal and state government policies to support jobs and keep people at work as a result of the coronavirus pandemic. So what you see in front of you is a graph of net satisfaction. It shows the proportion who are satisfied, less the proportion who are dissatisfied. So a positive number indicates that the proportion satisfied outweighs the proportion dissatisfied. And that's throughout this survey. What is interesting to note, of course, is that the high points occurred at a time when there were good news. JobKeeper seeker payments were starting to flow in, when there was easing of restrictions, when there were tentative signs of pickup in activity, and of course, the last one is the extension of JobKeeper, job seeker. And the down points were when we were receiving, well, not so good news, when there's huge job losses, when there were a lot of people under financial stress, and certainly during the emergence of second wave. What I'd like you to notice there is that while the number is positive, there's a downward trend. So moving on to the next topic. One of the key questions in the survey was that we were interested in knowing about the financial conditions of Australians as they navigate through the pandemic. We asked direct questions. We asked them to describe their current financial condition in terms of paying for essential goods and services such as bills, rents, and mortgages. And they had the option of choosing whether they are financially stressed, making ends meet, or financially comfortable. There are 2 points to note from the results over the 17 waves of the survey. The first one is that the proportion who are financially comfortable is consistently above making ends meet and the proportion who are financially stressed. However, if you think of the group of Australians who are vulnerable to financial distress, by that I mean those who are already considering themselves as being financially stressed, as well as those who are just making ends meet, then that proportion is about 50%. So there's a sense in which it's fair to say that the majority of Australians are vulnerable to financial distress. This information on this page is presented over 17 waves. So in the next few slides, I'm going to present the same information in slightly different form. So what we have there is the net financial condition. So I've calculated the proportion of financially comfortable minus proportion of financial stress and computed the means and the minimum and maximum for different groups of characteristics. So for the group labeled Australia, notice that the proportion of financially comfortable is greater than the proportion of financially stressed. So the mean is always above 0. And then you have the range of the minimum and maximum. Could you sort of turn your attention to the group labeled employed job keeper? What we have there is the demographic group of people who are employed by who are being supported by JobKeeper. There's clearly a variation of minimum and maximum throughout the 17 waves of the survey. However, on average, the red line is around 0. So that indicates that the proportion of financially stressed sort of just matches the proportion of financially comfortable, so that on average, the mean of the group is around 0, i.e. making ends meet. Now, in the next couple of surveys, I'm just going to go through a few more demographics. This is by age groups. What's interesting to observe here is that the age groups of people above 55, for the age groups above 55 years, the proportion of financially comfortable is always greater than the proportion of financially stressed, right? The variations is above 0. However, for the age groups below 35, what you find there is that on average, the net financial condition is below 0, meaning there are a lot more people who are financially stressed below the age of 35. Next. Now, this is a well-known results where you disaggregated the results or organized results around industry groups. The interesting thing to observe here is that there are 2 sectors, healthcare and education, where the variations in the net financial condition is above 0, whereas the accommodation, recreation, service group had the largest proportion of financially stressed. So moving on quickly, the data has got information about where people are located. So we were interested we wanted to find out whether there was a spatial dimension to financial stress. The ABS produced measures of regions, what they call statistical regions. And these regions are grouped, there are about 100,000 people in that group. And they're grouped so that there's connectivity between where people work and where they live. So I've just picked up one example, i.e. the SA Falls for Victoria. And that's what those dots and those labels mean. So in the South is one SA group, Warrnambool, South Wales is another statistical area grouping. On the vertical axis, we have the proportion of people who are vulnerable to adverse income and spending shocks. And so the higher the number, the greater the proportion of people who are vulnerable in that region. On the horizontal axis, that is one measure of the ABS index of economic, social, and disadvantage and disadvantage. The number greater than 1,000 means that people living in those regions have greater access to economic resources. What we were trying to do in the graphs was to see whether there was some relationship between proportion of financial distress and the location where you live and work. If you look at the graph, you think that there's a divide between metropolitan and regional Victoria, which kind of we expect that. However, there's no clear pattern. And this is something that we would like to sort of think a little bit more, and it's part of the research agenda. All right, the next question is spending. So the last question I want to talk about here is spending. We asked the survey respondents to think about their spending. This was done in June, and compare it to their spending in January. We also asked them to think ahead and compare their spending, their likely spending in December, and compare that to what they used to spend in January. The key message there is that the proportion of spending less is greater than the proportion spending more. That means that in general, people are spending, but it's not enough. There's a drop in consumption spending. That is unfortunate, as we've already heard that Australia is in recession, and that consumption is the largest proportion of GDP growth. So a fall in spending, a fall in consumption is going to be a big drag on GDP growth. To wrap up, what have we learned from the survey? We have learned that the JobKeeper, job seeker is helping make ends meet for some of the employed. We've also picked out the group that are vulnerable to financial distress, namely the under 35, hospitality sector. And while there is a spatial dimension, there's need for a lot more work there to sort of identify the key factors. Looking ahead, we're interested in finding out a bit more about expected spending. And so future surveys will concentrate more on spending and working. So one of the messages that we're getting from the survey is that there is a decline in satisfaction. And in fact, in the last wave 17, less than 10% of people expected the pandemic to be over within 3 months. It's going to be a long, long process, which sort of brings me to the question that there's now more and more discussions about mandatory requirements to minimize health risks versus to allow for more economic and social activities. And on this point, I will hand the presentation over to Yuti. Thank you.
Thanks, Gui. Let me just turn my slides on. Okay, so in the first week of June, we added one question to ask people, in the past 30 days, have you needed healthcare, needed to see a health professional but chose not to? So, and then we followed up with some same question in July, also in August. Let me show you some of the data. So if you focus on the last bar, then you can see that's the answer from June. So basically 29% of respondents said they have consulted a health professional in person, and 9% responded they have consulted via telehealth. 14% of them said they need it, but they chose not to. And 45% of people basically said they didn't need to consult during that past months, and 2% refused to answer. So if you look at in the last 2 or 3 months, basically 2 main messages here. So over time, more people needed to use healthcare, but also use more. So you can see, for example, in mid-August, 33% of respondents said they have consulted a doctor or other health professional in person. 11% said telehealth, and the proportion of people responded they did not use when they needed to also increases slightly, but also a lot of people sort of needed more in the past 2 months. So we looked into who are those people who avoided to seek health care when they needed to. First, I'll show you by gender and age. So this is a male, this current figure. And over time, so June, July, August. So the top line is for younger population. So you can see the younger people are more likely to forego necessary health care. And it hasn't improved much in the last 3 months. And the older people are less likely to forego necessary health care, and also they seem to have been returning to the healthcare system recently. If you look at the female, it's pretty much similar pattern. So younger people are more likely to avoid healthcare, and the older people are returning to the healthcare system. And then we look at by financial stress. So the top line is for those people who have financial stress, and compared to those who making ends meet, and the last line is for financially comfortable people. So the key message here is people with financial stress, they are 5 times more likely to avoid needed health care. And that difference hasn't been closing. So the problem seems remain over time. And if you think about this in perspective, not a small proportion of people with financial stress. If you look at the Melbourne Institute have a COVID-19 tracker. So it shows all this, the past few months, we tracking the data over time. Jess or Joe can put up a link there. So you can see basically about 20% of Australians said they are in financial stress. Especially for the young, about 30% of young population said they're in financial stress. So then we plotted the data by mental distress. So as you can see, the top line is for people who have high mental distress. That means we asked them a question in the past week. How often do you feel depressed or anxious? If they say all the time or most of the time, then we define those people as with high mental distress. And if they said no or little, then those are the low mental distress population. So as you can see clearly, people with mental distress are so much more likely to avoid needed health care. And this disparity has remained over time. It hasn't improved. And about 20% of population, they are in the high mental distress category. And again, especially for the young people, they are much higher than the older population. Then we look at proportion of people who use the healthcare, either by in-person or via telehealth in the past 30 days. So I'll show you 3 states, the 3 most popular states over time. So this is New South Wales, and then June, July, August. So the upper bar is in person and then telehealth. So the main message here is for apparently over time, you see more use of healthcare, which is consistent with what I just showed you, but also especially in the areas that are less affected by the COVID-19 in Queensland or New South Wales. Another thing is, like in Victoria, we had the second wave pandemic. So you can see a lot more use of telehealth compared to the other states, which is probably good. So to conclude, the access to healthcare, the needed healthcare, especially among the people with financial stress and mental distress, is continuing is a problem, and that hasn't been improved over time. So if this continues, it might affect long-term health effect for people and the healthcare system, and the disparity continues. So removing financial barriers to healthcare is one of the solutions. Maybe we should think about the bulk bill incentives should be targeted for people who really need, people with mental distress or in families suffering financial hardship. The other, we see over time more use of healthcare, but especially among women and older people. And the increased use could partially reflect people are catching up the services that have been delayed or avoided in April and May. But again, the increased use is really concentrated among people with less financial stress and mental distress. So people really need, they continue to have lower use of healthcare. The third point is the use of telehealth has been quite stable over the past 2 months, and it's the use is associated with geographic distribution of COVID cases. But one thing is, majority of the telehealth is really through telephone, maybe 97% of them through telephone instead of video conferencing. So for some patients, phone might not be the most appropriate because the doctor cannot see you and might not deliver the best quality of care. But while used appropriately, the use of telehealth is very convenient to patients who are less mobile and have difficult to travel, and could potentially maintain productivity because people don't have to take time off from their work. But I think we need to monitor the use of telehealth. So I'll stop here and move on to Regan.
Okay, great. Let me share my screen here. All right. Okay, so what I would like to talk about is how Australians are navigating activities and staying safe during COVID-19. There are 3 broad groupings that I'd like to talk about, and these are questions that were asked in the Taking the Pulse of the Nation survey. So one is on physical distancing. The second is how Australians are navigating life, and then pathways forward. So the first is about perceptions of physical distancing since the start of the pandemic. So one question that has been asked in the survey for several weeks is, how many people in your neighborhood do you think are following the recommendations about keeping a physical distance between themselves and others? And we asked the question this way because we wanted to avoid social desirability bias, and that is that people may be inclined to answer a question a certain way because they think that's socially acceptable. So we might, had we asked people if they themselves were physically distancing during the pandemic, or if they were physically distancing, then they might overreport such behavior if people think that that's good behavior. So we asked it in the perspective of how many people in the neighborhood. So that's the question that we asked. And then again, this was asked over several waves of the survey. And so what you're seeing on the right-hand side of the screen here are the groupings of responses. So either no one was physically distancing, few, some, most, everyone, or they don't know. So each of those 6 categories are in the graph. And then within each category, there are several bars, and the bars from left to right indicate the first survey, which was April 6th, all the way to the last time that we asked, which was in June 22nd. So the thing to kind of take away from this is that many people said that most people, certainly early in the pandemic, people were saying that most people were adhering to the physical distancing requirements. Most or everyone, but note that as time went on, so as you look within each of this, like if the people are reporting about 25% of the people are saying that everyone is adhering to physical distancing, but over time that's declining. So that's certainly a reflection of pandemic fatigue, and that's, you can certainly hear of that type of thing in many countries over this pandemic, but so the perceptions have been declining in terms of the proportion of people who are adhering to this. The next thing I'd like to show you is perceptions of physical distancing by age. So what this picture is showing is the by age group, how that particular age group responded across the 6 categories. So the age groups are blocked between 1824 up to 65 and older. And this is collecting all the data from across all the waves, and it's very similar responses for every week, every wave of the survey. But the thing to notice here is that the younger Australians really perceive less compliance. And you can see that by the proportions. The yellow proportion is much smaller. That's the response that most people are adhering to physical distancing. It's much smaller for younger Australians, and the proportion that say most or everyone increases as people get older. So, so one could ask, why is this the case that younger Australians are perceiving less compliance and older Australians are perceiving greater compliance? Well, it could be that younger Australians perceive more compliance because they're moving around more and they actually have a better assessment of the situation, or it could very well be that they're less compliant themselves. The survey doesn't allow us to distinguish between the two, but there certainly is a large difference by age. The next thing I'd like to show you is responses that we've gotten in the survey with respect to how Australians are navigating life during the pandemic. So the first thing I'd like to show you is about transportation usage. So at the end of June, we asked the question, are there various modes of transportation used, are these various modes of transportation used more, less, or the same in the previous 2 weeks than pre-COVID, or back in February? So on the right side of the screen are the distribution of responses using it less than before, the same, or more than before across the various modes of transportation. So trains, buses, taxis, own car, and walk and cycling. And the thing to note here is that both for trains, buses, and taxis, 50% are using those less than they were prior to COVID. And 70% are using their own car the same or more. So you can see that here. And those with children are actually 44% more likely to use their own car than those without children, sort of reflecting how people are shifting their modes of transportation. And about 85% of people are walking or cycling the same or more. So people are shifting how they're getting around during the pandemic. The next thing I'd like to show you with respect to navigating life is about safety and mask wearing. So between the end of May and the beginning of August, we asked Australians about how much they were limiting their economic activities due to COVID. And the proportion that said they limited their economic activities all or most of the time dropped from 59% to 45%. So over that 10-week period, there was about a 22% drop in the limitation of activity. So Australians are venturing out more. The second is about the support for mask wearing. So at the end of June, we asked about the support for mask wearing in many common places, on transportation, in shops, in the cinema, or at work. And at least 45% of people responded positively to support mask wearing, or even more. The last thing I'd like to show you with respect to navigating life is this interaction between masks and the use of transport. So this is support of the use of masks on public transport and actually the use of transport. So on the right side of the screen are two sets of people. So the people on the left are the people who say masks should be worn on public transport, and the bar on the right are the people who say masks should not be worn on public transport. So of the people who say masks should be worn on public transport, 58% of them are actually using public transport less. Whereas those who say masks should not be worn on public transport, 59% of them are using public transport the same or more. So that's suggesting that Australians might actually be more willing to use transport if everyone wore masks, because the people who say they support that people wear masks on public transport are actually using it less. So this might be an important thing to think about in terms of mandating mask usage on public transport and the willingness of people to use public transport. The final thing I'd like to show you are recently in the survey in the beginning of August, we asked Australians about their attitudes towards different sorts of policies as a pathway forward. So the question was, to allow a return to normal activities, which mandatory government regulations would you be willing to accept if needed in your area? So there was a very strong consensus, about 90% or more, who were in favor of policies such as quarantining if you're exposed to the virus, mandatory mask wearing, restricting capacity on public transport. However, there were other policies that Australians were far less in agreement about. So there was quite a bit of disagreement on policies such as closure of non-essential businesses, weekly routine testing. This is what's often called confidence testing, and contact tracing with mobile phone data. And this is especially, there's a special amount of disagreement with respect to age and politics. So in the upper graph, the data is split between less than 35 years old and greater than 35-year-old. And you can see with respect to weekly testing and phone tracing, young people are far less likely to support such a policy. And in terms of politics, this data is split by conservatives are people who support the Liberal or National parties, and they're in green, and the not conservatives are in blue. The conservatives are far less likely to support the closure of non-essential businesses, but they're more likely to support phone tracing with mobile phone data. So let me just conclude with a few takeaways. So we've seen over the course of the survey since beginning of April that Australians are venturing out more, and they're trying to navigate life using different sorts of options that they have available to themselves. They support mask wearing, especially with transport, quarantining if exposed, and restricting capacity on public transport. But consensus would need to be built for policies that are a little more restrictive, but could be effective. Okay, I will stop sharing my screen now.
Great. Thank you all. Thank you, Gui, Yuting, and Reagan. I'm gonna, there is one question I'm gonna ask of Yuting, and then I'm gonna move to Marcus so that Marcus gets a good chance, and then we can have a lengthy Q&A, because several of the questions I think would involve all four of you. Yuting, the question is, did you look at telehealth use by financial stress?
Yes, we did. The people with financial stress, they are slightly more likely to use telehealth. That's 11% compared to 9% among those with financially comfortable. But the proportion of them using in-person consultation are much, much less among people with financial stress. Good question.
Okay, great. Thank you, Yuting. Let me turn now to Marcus for his insights and reactions.
Well, I won't touch anything on the screen, and I hope this does work. Look, I just wanted to reflect briefly on the importance of this type of work in providing policy advice to government within a pandemic. I do remember when the pandemic first came upon us, and we realised very quickly as a bureaucracy that it was going to be difficult to rely on traditional information sources in order to advise government about the basic policy decisions that they were going to have to move into, and importantly the way that behaviours and attitudes had changed within the populace, and how that we couldn't rely on the past as a predictor of the future. So very quickly, when we did move to essentially a new way of operating within the bureaucracy and within government by creating missions and the crisis cabinet structure that we currently support at the moment, and we had to move very quickly from your traditional information sources, administrative data and ABS, to rely on these types of surveys that we're speaking to today. So we moved very quickly to advise Cabinet on essentially administrative data that we've got at the moment, existing traditional sources such as the ABS, but importantly, a lot of new data sources. So stated preference surveys was a big part of that, because we knew that behaviours and attitudes were changing, as well as some of the innovative surveys that the ABS did as well. I mean, in doing so, the way that we changed the advice that we were providing, essentially through my role, which was quite interesting, was to take some of these new information sources, and because they cut across essentially all of the missions of government that we'd established, providing advice directly into government, into that crisis cabinet structure with these types of data sources. And what we found was that the various data sources were speaking to each other and giving us insights in very real life terms. So just as the previous speakers have spoken to, we very quickly realised, look, it's unemployed, young female people that are particularly hard hit, and we had to target our policies accordingly. We were observing a lot of non-compliance and desire for economic participation or subsistence living from those that weren't being supported by JobKeeper and similar proposals, and so needed to target some particular policy measures towards them, again informed by this type of survey work that identified that those people were the most financially vulnerable, and also suffering from compliance issues as well, with some of our restrictions on public movement. We also use these sort of data sources when we're identifying isolation, essentially options in our COVID coronavirus line, which is 1-800-767-5398 for those that are interested, adding special features for those that are socially isolated through our Red Cross material that we have there. We also observed quite a bit of material. It was basically in the policy identification space, a lot of material that was coming through around social isolation and the need to provide supports for those who are facing social isolation. So I think that informs some of the settings you're seeing at the moment around singles being able to see singles moving forward in the future, as well as another component that we used this material for was to identify those people that were at most risk of breaking social isolation or similar methods, or were doing it the tough under home isolation. And we used that to really identify what messaging worked. So we were taking this material from essentially the Melbourne Institute and our own behavioural insights people. They were talking to each other and really identifying what messages and motivations are really driving these people, so that we can make sure that when we're communicating with them, we're communicating with them in terms of the type of issues that most benefit them. In terms of the transport, that was again something that we were quite interested in, because we'd been so used to the transport system building up and up and up in terms of volumes that we didn't really know what to expect going into the reopening of the economy, and really understanding people's fear of public transport, of shared transport. We very quickly need to adjust our policies as we're thinking through, geez, everyone's going to hop in their car now. They're not going to be getting on the public transport system as much as we're used to, and we therefore have to change both our messaging as well as our policy focus to think about how we're going to deal with a lot of people on the roads when people start to open up, while COVID's still operating within our borders, as opposed to thinking about how we're going to manage the COVID safe public transport system. So I just wanted to provide a couple of examples really of how we are using this type of work, both in the policy development and identification phase, as well as the policy design phase, and just leave it there for any questions about how we use this type of information in public policy making. Thank you.
Great. Thank you, Marcus. So we do have time for a few questions. I will remind our viewers to please put in your questions. Any questions we don't get to, we will be able to answer online when we post the recording of the colloquium. So the first question is going to be geared towards Gwei, but Marcus, you may also want to chime in. So Gwei, in your results, you suggest that that there's a fair number of people who are arguably financially vulnerable or vulnerable to financial stress. And given we're now officially in a recession, if you compare, if you could kind of extrapolate what this might mean for getting out of the recession, given this is a recession driven by COVID-19 as opposed to past recessions. Do you have any insights to help us understand how to minimize that vulnerability to ensure things don't get worse?
Okay, tough question. So we have data on survey for the period since the lockdown, and we have sort of a data during the period when there was some easing, and then we have data for the period when it was just Victoria who was under lockdown. So if you like, the data is giving us a sort of a picture of the history as we move from very tight lockdown to some easing. What we see from the time series is that although there are variations, there is actually no discernible trend, which is interesting in the sense that that means there's always a group of Australians who are financially stressed. And there's a group of comfortable. What we're picking up is the group in the middle, which are currently, at the moment, the message is a little bit distorted because we've got support from JobKeeper, JobServe. The question is, if that is removed, will we see that that group becomes more financially stressed? And at the moment, the signs are, they are moving in that direction. That's part of the reason why we started looking more closely at the spendings, working patterns, and also why I put up that graph about savings, because there is evidence there that there is a group of people who are saving more. And so, although I don't think I can give you a definitive answer to sort of say we're going to get out of this, because I think this data shows that there is always a group in Australia who are financially distressed. And that's the group that policies need to target to lift them from their current position. The other group was of wavering between making ends meet and financially uncomfortable. It's there, but what is interesting to observe is whether the savings and the spending pattern is going to change. Until we know a little bit more about that, I don't think I can sort of give a definitive answer to sort of say we're going to get out of financial distress short of the economy opening up and we start seeing changes in people's working behavior and an improvement in our trade relationships.
Okay, great. Thank you.
The one thing I would add to this is I think we're getting through various data sources insight into how much the economy is being driven by will suffer if there is a reduction in consumption spending across the economy, and how much that consumption spending is being driven by government welfare measures. And so obviously in the public policy space, we're very concerned to understand what will happen if those welfare supports are removed at any level of government, and really to understand what impact that is going to have both on the affected individuals, and therefore what supports might need to be scaled up to support those individuals with their mental health, but also what to do to ensure that jobs growth recovers effectively, which will primarily be driven by consumption growth. And what we can do about those issues is something that we're watching very carefully. And I think when we're starting to understand how these the behaviours and attitudes of people who are currently financially stressed will be critical to understand what might happen if that cohort increases over time with the welfare cliff that could emerge in coming months. Thank you.
Great, thank you. So I have noted that we are out of time. However, I would like to get in 2 more questions. So for those of you who can stay on, that would be great. So the first question is for you, Ting. And the question is, do you have any comparison available in terms of people experiencing financial stress choosing not to access healthcare services before the pandemic? So essentially, how disturbing should we think of these findings?
It's a very good question. Unfortunately, we don't have any data before that. We know people, they have financial stress. They definitely would have trouble access to healthcare because of cost, everything else. But I think the current issue is partially the cost, but also partially some other things. So no, we don't have a clear data before pandemic.
Okay, great. Thank you. And then one more question for Reagan. I will comment, a question's been asked whether or not we are going to have future ways of the surveys to ask questions around building resilience. And my short answer of that is definitely. We are continuing to adapt our questions to reflect what is going on. But my question for you, Reagan, is about masks and the surprising finding in our survey that that approximately 90% of people seem to be okay with wearing masks, whereas if you look in other countries, namely the United States, there seems to be strong resistance. So do you have any insights in terms of your comparison of the political parties, the age ranges, or anything that could help explain why we seem to be very different in Australia?
So kind of circling back to a bit of what Gui and Marcus were saying too, is that if part of any countries getting out of these recessions that they're in right now is really about consumer confidence. And if people feel safe, they will go out and they'll spend their money. And part of feeling safe is mask wearing, is social distancing, is feeling like you can go about your business feeling very safe. The difference in Australia, I mean, it's really remarkable, the consensus in terms of people's willingness to wear masks, and it's not a political battle as it is in many countries, certainly in the United States, and you can see it. The United States is still the leader in the number of cases, and people are unwilling to wear masks. It's a very simple thing to do to reduce the spread and to be able to carry on about business. So kudos to Australians for being so understanding that it's a very simple step to take and very important actually in terms of recovery.
Great, Thank you. So let me thank our speakers, and let me thank you, the audience. I hope you've enjoyed this colloquium, and I look forward to seeing you at our next colloquium, which is going to be on September 22nd, where Professor Lisa Cameron and Dr. Diana Contreras Suarez will be presenting on the topic of the consequences of child marriage in Indonesia. So thank you very much, and I look forward to seeing you soon.